Hi, this is Dr. Khalil with Mansfield Aesthetics. I wanted to talk to you guys a little bit about hair transplant aftercare. Basically, what are the things to do, not to do after your hair transplant surgery. Hair transplant surgery is becoming more widely popular because it is a permanent solution to hair loss. It's a really good option for a minimally invasive procedure that doesn't leave a lot of visible scarring and looks very natural with permanent results. The surgery can be quite daunting, especially in the post-op process. So it's good to have a little guideline for the do's and don'ts after a FUE or follicular unit extraction surgery like SmartGraft. After the surgery, you do need to have an aftercare kit ready. So usually a antibiotic course, a bottle of Tylenol or ibuprofen as long as you don't have any allergies, just for post-operative pain. The antibiotic course is usually started the day before surgery and then continued for a course of 7 days. Have some Johnson & Johnson baby shampoo ready just to gently wash those hair grafts at about day 3, and a little plastic cup to use in the shower so that you can pour the water onto your head indirectly without letting the water from the shower hit those grafts and potentially knock them out. Additionally, we usually prescribe prednisone for swelling, which is taken usually the day after surgery for about 5 days. We usually do that for the post-operative swelling. Additionally, we will place a elastic band across the forehead to prevent the fluid from going down into the upper eye area and to prevent facial swelling. It's a good idea to have a neck pillow and to have a little mister of saline spray. That's something that I provide for my clients because, it's not something I want you to just go buy over the counter. We want you to use a sterile saline that was prepared at the clinic, and that way you can mist and spray those grafts once an hour for the first 3 days to prevent them from getting too dried or desiccated. The other things to keep in mind for hair transplant surgery are the things to avoid. So the number one thing is avoid doing too much activity after surgery, avoid doing exercise, physical labor, avoid anything where you're going to lean forward and create pressure in the forehead area and potentially damage or pop out those newly placed hair grafts. So make sure you take a good decent amount of time off of work. Now is the perfect time because people are more working remotely from home, but you are going to have some noticeable changes. So even if you're on that video call, as long as you want to stay discreet, you may want to take off about a week so that you can allow some proper healing to take place before people will see your hairline again. Avoid direct sunlight, avoid laser helmets, avoid sunburns, extremes of heat or cold. You want to be babying those grafts for the first 30 days. You don't want to be exposing them to direct sunlight because that could potentially harm those grafts with the UV radiation. Avoid scratching and touching these grafts. No matter how itchy it might get, you may want to just spray it with the saline spray, but within the first 24 hours, they're pretty well coagulated into the scalp, and it would take a pretty brisk brush or rubbing your forehead on a pillow pretty briskly to knock them out, but it is still possible, so we don't want you to touch those for about the first 3 days. Other things are avoid drinking alcohol for the first 30 days after your surgery. Most people say, oh, you don't need to worry about that after surgery because of it's coagulated and won't bleed. Well, alcohol is known to be a major cause of hair loss in men and women. So not saying that you can't ever drink alcohol again, but during that acute phase, you don't want to be exposing your body or those newly placed hair grafts to alcohol. Additionally, smoking and vaping, you need to avoid those for the first 30 days and permanently if possible. Those are another major cause of hair loss in general. In context to a hair transplant procedure, you're going to be cutting off the circulation to those newly placed grafts. Nicotine and smoking are vasoconstrictors, and so those are things that have to be avoided. And I would say smoking and vaping needs to be avoided for a full 6 months after your hair transplant procedure. Once again, indefinitely if possible. Harsh chemicals and medicated shampoos, topical medications, we don't want you applying those at all for the first 30 days after surgery, specifically to the areas where we have grafted or placed new hair grafts. This includes minoxidil and Rogaine. It includes medicated shampoos. Additionally, things to avoid are trying to clean the area with isopropyl alcohol or rubbing alcohol. Even things like triple antibiotics and neosporin, hydrogen peroxide, you do not want to place any of those things on these newly placed grafts. They are delicate and they need time to recover and heal. Even those over-the-counter hair loss remedies, iodine, you want to avoid. After 30 days, you can go back to using medicated shampoos. I like to tell people to start using ketoconazole shampoo, which you can get over the counter. It's known by brand name Nizoral. It's a 1% ketoconazole shampoo and can actually be used about 3 times a week to prevent dandruff and to also help regrow hair. Additionally, essential oils, we want to avoid those. Another thing to avoid is participating in strenuous exercises. We would want to keep that heart rate nice and low after surgery. So you can do things like walking, but when it comes to things like weightlifting, CrossFit, squats, push-ups, those have to be avoided for the first 2 weeks after surgery. Other activities that could be related to that are sauna, steam. You want to avoid those things. Even in the shower in general, if you're taking a shower, you don't want to take a long 20-minute shower with the doors closed and a lot of heat and a lot of steam. That's going to cause some fluid to develop in those hair follicles, and they're going to swell up, and then they're going to shrink down when you get out of that steam, and you're going to be causing a lot of fluid shifting into that newly placed hair graft. So that's going to delay your healing and potentially cause you to lose hair grafts. So those are things to avoid. The first week, you don't want the pressurized water from a shower head to hit these hair grafts. So what we usually suggest is for people to take a lukewarm cup of water, mix in some Johnson & Johnson baby shampoo in there, and gently pour it over those grafts indirectly. So you're not creating a lot of pressure to hit those things and knock them out. And then you can just rinse it with lukewarm water and let it air dry. Usually recommend washing those at about day 3 after your surgery. And then the things to do are to generously moisturize your hair grafts with the saline mister that we provide for you at the clinic. It's safe to use. It's not going to knock out the hair grafts, and it's going to prevent them from getting desiccated. Overall, hair transplant takes about 12 months from start to finish to get the full growth and results. You'll start to see growth right around month 6, and with the addition of some of the technologies we use here with SmartGraft and with PRP, some people see a lot of growth right around month 4 to 5. Let us know if you like our video. Thank you.